Welcome everybody. With you, Dr. Magdy Abdel, consultant of infectious disease, hepatology, and gastroenterology. Today, our topic about Kawasaki disease. This disease is rare in our countries, but famous in Japan and Korea. Usually affect children between 2 years and 5 years. This disease usually affects males more than females, and sometimes see children below 2 years and after 5 years, but this is rare. This disease usually come in spring and in winter. We don't know the cause, but most probably this disease is autoimmune disease, affect vessels, whether arteries or veins, medium size. This disease not infectious, and also this disease complicated by coronary artery aneurysm, so it is considered dangerous disease. If not treated, usually 25% of affected cases suffer from coronary artery aneurysm, and this may lead to cardiac problem and cardiac asthma, and may lead to infarction in the heart. The mortality may reach to 2% of cases. If we discovered the case and treated well in the hospital, usually the complication become less and the mortality become less. The doctor who treat these cases usually rheumatology and also infectious disease specialist and cardiologist also. All this team participate in the treatment of these cases. The symptoms: fever more than 5 days, not affected by paracetamol or antibiotic. Also congestion of the conjunctiva with no suppuration, red tongue, lips and throat, and we call this tongue strawberry. Also we find rash in the trunk. The hand and the foot swelling with redness and peeling around the nails. Also we find lymph node in the neck more than 1.5 centimeters. So if we find 4 factors of this with fever, we diagnose the case Kawasaki disease. But if we find 3 factors of this with echo, find coronary artery aneurysm, so also we diagnose the condition Kawasaki disease. Kawasaki disease called by Kawasaki doctor, Japanese doctor, who discovered this condition 1967. Sometimes this condition misdiagnoses with another condition like scarlet fever and juvenile rheumatoid arthritis. So we have to there is the differential diagnosis of this condition between this condition and the other disease. Also rickettsial disease can be similar to these symptoms and the signs. We can do investigations like CBC, we find anemia, we find platelets high, and also CRP is high, ESR is high, hepatic enzymes high. Also, sometimes we find by abdominal ultrasonography gallbladder swelling. As regards this disease, as I told you, there is another disease similar to this disease called Kawasaki-like syndrome. This disease, Kawasaki-like syndrome, we find it in our countries and all over the world in children, but accompanied with COVID-19. So it is important to discover this condition. What about the treatment? The treatment is aspirin by high doses. We know that aspirin can make some complication like Reye syndrome in children. This Reye syndrome may lead to acute hepatic failure and meningoencephalitis. So take care during administration of aspirin in the children. Usually we treat Kawasaki disease in the hospital because this need teamwork from doctors, experience. And also we give intravenous immunoglobulin. Both aspirin and intravenous immunoglobulin give good results and the fever come down. But sometimes we give corticosteroid, sometimes we give cyclophosphamide, sometimes we make plasma exchange in some cases. Nowadays, there is medical research work about biological drugs, but until now not proven to use. As regards this disease, we know that this disease, as I told you, autoimmune disease. So this depends on genetic causes and biological, ecological causes. Maybe infection, the precipitating cause. We don't know. Until now, we don't know the cause of this disease. Thank you very much.